So now, after having discussed about the hormones and as well as related agents being used in the management of various malignancies, now let me discuss the other anti-cancer drugs. Right, among the other anti-cancer drugs, right, the very important drug what we have is L-Asparaginase. Right, the other drug what we have is the L-Asparaginase. If you see this L-Asparaginase, remember as such this L-Asparaginase, it is an enzyme, right? It is an enzyme used for the treatment of leukemias and lymphomas, right? Remember as such this is an enzyme which is used in the treatment of, right, leukemias and as well as the lymphomas, right? Now, as such, these two tumors, that is leukemias and as well as lymphomas, these tumors, they require exogenous asparagine for their growth, right? So both of these tumors, they require, right, exogenous asparagine for growth of the tumor, right, for growth of the tumor. Now you take this L-Asparaginase. What does this L-Asparaginase will do? This L-Asparaginase, it acts by depleting this amino acid asparagine within the serum. Okay, so mechanism of action of this particular drug, if you see, this particular L-Asparaginase, it acts by depleting, right, asparagine amino acid within the serum. Now if you take the route of administration of this L-Asparaginase, it is administered by the intravenous route. And if you take the adverse effects of this particular L-Asparaginase, the adverse effects include the hypersensitivity reactions, right? The adverse effects include hypersensitivity reactions. It can also cause, right, acute pancreatitis and as well as, right, cortical vein thrombosis, right? So these are the adverse effects of this particular L-Asparaginase. Now, other anti-cancer agent what we have is the Pentostatin, right? Other anti-cancer drug what we have is the Pentostatin. Now Pentostatin, if you see, this is the drug used for the treatment of hairy cell leukemia, right? Used in the treatment of hairy cell leukemia. Now as such, remember, in case of hairy cell leukemia, the drug of choice is cladribine, right? The drug of choice in case of hairy cell leukemia, it is your cladribine. Now let me tell you the mechanism of action of this Pentostatin. Remember, Pentostatin, it acts by inhibiting the enzyme adenosine deaminase. Okay, so it acts by inhibiting the enzyme, that is adenosine. It acts by inhibiting the enzyme adenosine, right, adenosine deaminase. Now even though we have the word called statin, it has no 𝐻𝐵-CoA reductase inhibiting action, right? Even though it has the word statin, it has no 𝐻𝐵-CoA reductase inhibiting action. So this is an important point you need to remember, right? So it is used in case of treatment of hairy cell leukemia, and the drug of choice is what? Cladribine. Next, we have another important drug, that is Octreotide, right? Another important drug, that is Octreotide. Remember, Octreotide, it is a long-acting somatostatin analog, right? Somatostatin analog. If you take this particular drug, in which malignancy this particular somatostatin is useful is, this is useful in the treatment of islet cell carcinoma of the pancreas, right? Useful in the treatment of islet cell carcinoma. Now what does this particular Octreotide will do is, Octreotide, it will decrease both insulin and as well as, right, it will decrease both insulin and as well as the glucagon secretion. Now Now let me tell you the other uses of the octreotide. As such, octreotide it is used in case of islet cell carcinoma. And apart from this particular islet cell carcinoma, this octreotide it is useful in case of secretory diarrhea. Remember, this octreotide useful in case of secretory diarrhea. And the other uses include the esophageal varices in patients with the portal hypertension. And this octreotide, remember, is also used in the treatment of one endocrine disorder, that is acromegaly. So acromegaly is a clinical condition which is characterized by increase in the growth hormone of the individual. Right, characterized by increase in the growth hormone of the individual. So that is your octreotide. So let me shortly revise here. So the other anti-cancer drugs, that is L-Asparaginase. Remember, as such, this is an enzyme, and this is useful in the treatment of leukemias and as well as lymphomas. And these tumors, right, these tumors, they require exogenous asparagine for their growth. And what this L-Asparaginase will do is, L-Asparaginase it acts by depleting this amino acid within the serum. And route of administration of this L-Asparaginase is the intravenous route. And the adverse effects is, they include severe hypersensitivity reactions, acute pancreatitis and cortical vein thrombosis. And you take the drug that is Pentostatin. This drug is useful for the treatment of the hairy cell leukemia. And the drug of choice for this particular hairy cell leukemia is the cladribine. In this Pentostatin, it acts by inhibiting the enzyme that is adenosine deaminase. Remember, even though the word statin is there in Pentostatin, it has no 𝐒𝐻MG-CoA reductase inhibiting action. Next, you take the drug Octreotide. Octreotide, it is a long-acting somatostatin analog, and it is useful in the treatment of the islet cell carcinoma. This particular octreotide, it will decrease both insulin and as well as glucagon secretion. The other uses include the secretory diarrhea, esophageal varices and as well as the acromegaly. And let me discuss few more anti-cancer drugs. Now let me discuss the other anti-cancer drug, that is Plicamycin. Right, that is Plicamycin. Now if you see this drug, that is Plicamycin, remember it is used for hypercalcemia of malignancy and as well as in case of metastatic testicular carcinoma. Right, used in case of hypercalcemia of malignancy, and it is also used in case of metastatic testicular carcinoma or tumors. Now why are they used in these particular malignancies? Why Plicamycin is used? Remember, in both of these, that is hypercalcemia of malignancy and as well as metastatic testicular tumors, there is increased serum levels. If you use this particular Plicamycin, it will decrease the serum calcium levels. Right, Plicamycin will decrease the serum calcium levels in both of these particular malignancies. Now apart from Plicamycin, we have another important anti-cancer drug, that is hydroxyurea. Right, other important anti-cancer drug, that is hydroxyurea. Now if you take this hydroxyurea, remember it is the drug used for sickle cell anemia, essential thrombocytosis and as well as the polycythemia vera. Right, used in the treatment of sickle cell anemia, used in the treatment of essential thrombocytosis. Right, essential thrombocytosis is a clinical condition which is characterized by increase in the platelet count than normal. Right, and the other clinical condition where the hydroxyurea used is in case of polycythemia vera. Remember, polycythemia vera is a clinical condition which is characterized by increase in the hemoglobin or increase in the RBC count, is a clinical condition which is characterized by increase in the WBC count and as well as the platelet count. So increased RBC, WBC and as well as platelet count, together we constitute what is called as polycythemia vera. Next, now where is this particular hydroxyurea used in certain leukemias? In which type of leukemia this hydroxyurea is used is, it can be used in case of chronic myeloid leukemia. Now how does this particular drug acts in case of chronic myeloid leukemia? Remember, this hydroxyurea, it acts by inhibiting the important substance, that is ribonucleoside reductase. Ribonucleoside reductase enzyme, it is required for rate limiting step in the synthesis of the DNA, right? So this hydroxyurea, remember, it acts by inhibiting the enzyme that is ribonucleotide reductase, right? This particular ribonucleoside, right, ribonucleoside reductase. Now this particular ribonucleoside reductase, this is an enzyme which is required for rate limiting step in the synthesis of DNA. So this is an enzyme which is required for rate limiting step in the synthesis of the DNA. Next, now you take in case of sickle cell anemia. In sickle cell anemia, what the hydroxyurea will do is, in sickle cell anemia, hydroxyurea will increase the solubility of the hemoglobin by inducing the synthesis of the fetal hemoglobin, right? So in sickle cell anemia, this particular hydroxyurea, it increases, right, it increases the solubility of the hemoglobin by inducing the synthesis of, right, by inducing the synthesis of the fetal hemoglobin. Now what does this fetal hemoglobin contain? The fetal hemoglobin, it contains alpha 2 and as well as the gamma 2 chains, right? Alpha 2 and as well as the gamma 2 chains. Whereas you take in case of the normal adult hemoglobin, right, we have alpha 2 beta 2 chains. Now in case of sickle cell anemia, like the mutation is within the beta globin chain, that is on the 6th position. Now this particular beta globin chain will be replaced by the gamma chain in case of the fetal hemoglobin. So this particular hydroxyurea will increase the solubility of the hemoglobin by inducing the synthesis of the fetal hemoglobin. Fetal hemoglobin contains 2 alpha chains and 2 gamma chains. Whereas in case of sickle cell anemia, where exactly is the problem? The problem is within the beta globin chain. So now if you give hydroxyurea, it will prevent the formation of that particular adult hemoglobin and it will induce the solubility of the hemoglobin by synthesis of the fetal hemoglobin. Next, you take in case of essential thrombocytosis. Remember, in essential thrombocytosis, this particular hydroxyurea, it is considered as the drug of choice, right? As such, if the patient is not responding to this hydroxyurea, then we add a drug called as anagrelide. Okay, so in case of essential thrombocytosis, this hydroxyurea, it is considered as drug of choice. And if the patient is not responding to the hydroxyurea, then the other important substance, that is, right, another important substance, that is anagrelide, is added, right? And this particular hydroxyurea, the route of administration of this drug is the oral route of administration in all these purposes. Either you take in case of sickle cell anemia, essential thrombocytosis, or polycythemia vera, or chronic myeloid leukemia, this hydroxyurea, it is given in the form of oral route. So you take these drugs, that is Plicamycin, used in case of hypercalcemia of malignancy and as well as metastatic testicular tumors, right? They will reduce the serum calcium levels in these malignancies. And you take the drug, that is the hydroxyurea. It is the drug used for sickle cell anemia, essential thrombocytosis and polycythemia vera. And it can also be used in case of chronic myeloid leukemia. And remember, this particular drug, it acts by inhibiting the ribonucleoside reductase. And this ribonucleoside reductase is the enzyme. It is the enzyme which is required for the rate limiting step in case of the DNA synthesis. In case of sickle cell anemia, this hydroxyurea, it increases the solubility of the hemoglobin by inducing the synthesis of the fetal hemoglobin. That is, by inducing the solubility of the hemoglobin, this particular hydroxyurea, it will reduce the vaso-occlusive events. And the other important thing is, in case of essential thrombocytosis, this hydroxyurea, it is considered as the drug of choice, and if there is no response, then anagrelide may be added. And for all these purposes, this hydroxyurea, it is given through the oral route.